All right, I thought I would put this video together. We're getting a lot of questions, and I thought I would just cover some very basic information about peptides. Specifically, we're going to focus more on the GLPs. There's a lot of hype right now coming out. And so I thought I would just go on and create this video that you can kind of just sit with and think about some of the things that we're talking about. All right, so let's talk about the truth about compounded peptides. I know the most common ones you're going to see are things like GLP-1, which is semaglutide. That's the active ingredient that we see in Ozempic. And then Tirzepatide, which is a GLP-1 and a GIP. So it's a dual agonist, which means it even has more bells and whistles of what it can do in the body. And that is the active ingredient that you'll find in, let's say, Zepbound or Mounjaro. All right, so first of all, let's look at the big picture. Peptides, they're they seem like magic, but I don't want you to think of them as magic. They are targeted signals that your body already understands. They already have the ability to do this. Unfortunately, through our lifestyles and even just from birth, we can have so-called deficiencies in these signalings. And so here, the big thing is when you use legitimate, keyword, legitimate 503A compounding pharmacies, these are sterile, they're prescription, they're pharmacist made. And because of that, we can actually tailor the doses. It's not like you're getting some pen that you're just injecting whatever dose they have. You don't have any wiggle room, usually only if you're going up in dosing. So these, when we're looking at compounded, these are minimizing filters and they match the patient instead of forcing the patient to match more that mass marketed, mass production of these pens. And so that's a huge win with compounders. So what peptides are and why injections, I think that's another thing I get because there's a lot of different things like orals and, collagen. They think that's a peptide, which it is. It's a food grade peptide. But here's the gist of it. Peptides are short chain amino acids that act like cellular messaging in your body. That's what they do. It's just like text messaging, direct text message to someone that you want to get a message to. Boom, it's there. The thing is, these are fragile in the gut. So stomach acid and GI enzymes, they kind of just chop them up. So injections, either sub-Q or in some cases, you might want to do them intermuscular, just a little bit longer of a needle and a little bit more specific on where you're injecting them. These really remain to be the most reliable route for kind of more the thought of these are therapeutic peptides. So oral peptides, there's plenty of them out there. My thought is though, they just don't deliver the suitable replacement unless you absolutely, I mean, absolutely can't do an injection. But you have to know that the results aren't going to be the same and it's going to take you a lot longer and you're really going to have to be like on top of all of the things, right? The diet, the exercise, maybe extra supplementation. These are all going to have to be in checked. They're going to fight with your digestive system, or even if it's just sublingual. They just don't have the bang for the buck that injections do. But when you go through the gut, you're dealing with enzymes, low permeability of the gut, and that first pass metabolism kind of just wrecks that bioavailability to, get the peptides to do what they need to do. So basically, if you want predictable clinical effects from most peptides, you want to inject them. And these needles are either 5/16 of an inch to a half inch at most and injected into the belly or inner thigh. It's really, you don't even feel it. Unless you keep poking yourself, you're not going to feel this. Most people don't even realize they've actually put the needle into their skin. And they're like, that was easy. So don't fear the needles. After you've done one or two injections on your own, you're like, okay, that's not a big deal. All right, so compounded, these GLP GIPs versus the brand pens, what's safe, what that really means. Let's just kind of discuss this because we get this question a lot. So first, safe means that it's a correct molecular structure. There's no weird salts or anything added with the compounding pharmacies. These are sterile preparations at the facility, their accurate concentration, clean labeling, and dosing that actually, let's just say, respects the body's physiology. Peptides that are coming from compounding pharmacies are made to mimic the human body's production of their own peptide production. So it is such a better alternative than these pens. So 503A pharmacies, these are state licensed and I would say most have, I know all the ones we work with have FDA oversight. The FDA has been very explicit about when compounding is appropriate and what to avoid. So no salting, none of these like crazy fillers, which is weird because the big pharmaceutical companies, which I'm going to talk about here in a minute, what they're actually putting in there, what's on their sheets. So labeling has to be legit. They have to come from a licensed facility. So working with a legit 503A pharmacy, they really kind of, you can feel safe that you're not getting some knockoff or off some boat from China or who knows where. It's not made in somebody's basement or garage. Um, the problem is big pharma doesn't necessarily have to answer to a lot of these questions. If we haven't learned one thing in the last 5, 6 years, it's that. So I believe compounding pharmacies, they have a much more oversight. They are so scrutinized, and so they have to be on top of things. So why compounding can be better for some patients, I would say probably most patients, but first of all, we can customize the dose and titration of the peptide you're getting. We can do microdosing, we can do low dosing. This is so much better than just, you could be, you know, 4'11" versus somebody who's 6 foot and 300 pounds, and the 4'11" person weighs 100 and 25, and they just want to lose a little bit. You don't want the same dosing as that heavier person at all. I mean, you're going to get sick, you're going to have some problems. So when we're looking at compounding pharmacies, we're looking at the individual, we're looking at what the dosing should look like. And the other thing is now, because of all the FDA stuff and all of the big, in the last almost a year now, the FDA coming down, basically siding with big pharma that these peptides have to be kind of made individualized. They can't use any kind of formulation that could mimic the big pharma. So what they're doing to get around this is they add excipients, and these are things like B12, B6, L-carnitine, and even some cases now, we have a telehealth platform that's even giving the option to add NAD+, which is awesome. So when you're looking at the big pharma, you're not going to get this option at all. All right, so let's kind of just think about this as a reality check and fillers. I said I would mention this, and I'm just going to use Ozempic as one example, but Ozempic list. Now, this is on their paper. It has propylene glycol and phenol among its added ingredient, inactive ingredients that are in their formula. Now, they will argue that most patients tolerate these fine, but here's the deal. Who wants to put propylene glycol injected right into, I don't care if it's 0.25%. I mean, you're still injecting propylene glycol into your body. So, all right. So I want to now kind of just switch a little gears. I want to kind of compare this and do like a thyroid analogy, because this is something I see a lot in clinic. Mainstream medical establishment, what they do is when it comes to thyroid, they default to levothyroxine or Synthroid. That's their gold standard in treating thyroid, which is, to me, malpractice, because you are only looking at the thyroid stimulating hormone that's coming from the pituitary. You're not even addressing what is actually going on with the thyroid. Now, what do? They prescribe levo or Synthroid. Synthetic. I mean, they even tell you that it's not even that great. But levothyroxine and Synthroid are just T4. This is the inactive hormone for your thyroid. It has to be converted to T3. Every cell in your body has T3 receptors, and it has to be converted between the gut and the liver. Mostly the liver, believe it or not, is the key. And I'm going to mention this probably down the road here on this talk, but Tirzepatide just got FDA approval for non-alcoholic fatty liver disease. Hello, that's where about 60 to 80% of your thyroid conversion from T4 to active T3, all those receptors, every cell in your body, where it converts from T4 to T3. Huge. So this tirzepatide can actually help your body with its thyroid health more than anything, really, especially a supplement. So I'm super excited about that, but I won't get too much into the thyroid, but my thought here is when you're using compounded thyroid replacement hormone, you are going to be using things like Armor or NP. They've taken a couple off the market, which is unfortunate because they worked really well. Which maybe that's why they took them off the market. But these actually mimic the actual thyroid and how it works. It has a mix of the T4 and T3. And the problem is you got all these people on Levo and Synthroid, and they don't even know how they've never tested free T3 or T3 or even free T4. They've never even tested those. And they just keep pumping Levo or Synthroid. You could actually be overdosing on T4 because if your conversion isn't right, you've got too much T4 and not enough T3. So thyroid health is a great analogy to compounding, how better compounding thyroid hormone replacement is versus, your standard gold standard Levo or Synthroid. All right, so let's talk about the difference because I've mentioned tirzepatide a lot, and many of you, when we think of Ozempic, the active ingredient in Ozempic is semaglutide, and I I don't even like to offer semaglutide. We do for a couple reasons. I won't get into that, but we do have it available. But tirzepatide is the one that I am seeing in practice great results with. So when you go head-to-head trials with tirzepatide, it shows that it beats semaglutide like unbelievably well. So semaglutide is a GLP-1. So for things like helping with A1C and just weight, it's good for that. It can help with some of that food noise and appetite control. When they discovered GIP agonists, it took semaglutide the GLP-1 to a whole new level. Clinically, faster appetite reset, stronger weight signals for many to, help like initiate the fat burning process, addressing the visceral fat. That's that icky fat that you don't necessarily squeeze. Think of liver belly or it's surrounding your organs. You have better muscle protection. It's a better mood enhancement. Just everything that semaglutide does, and then plus other things it's just a wonderful and it's not even that much more expensive compared to what it does. So tirzepatide is, like I said, it's also just recently been approved for non-alcoholic fatty liver disease as well as diabetes and weight management. So it's a great just if you feel like you've done everything right and you can't get results, or you're in a hormonal chaotic hot mess situation and everything you are doing, which you think is right, isn't moving the needle. This honestly is one of the best things you can do. I have been on it since February of 2025, and I've taken a little bit of time off here and there, and I've switched from tirzepatide to semaglutide, and then quickly switched back to tirzepatide because I just didn't feel like it was giving me what I needed. And now I'm actually testing another one that is up and coming in the market. But honestly, tirzepatide is a great place to start because it just nails so many things that keep us from getting results. So one of the other big questions that we get is, will I be on this forever? Maybe if you want to be, but let's just say short answer, no. But you have to plan for a long run with this because depending where you're at now, for some people, they might do 3 months and then take a couple months off, and then they maybe come back and do some microdosing, or it's very customized when you're working with practitioners that use compounded versions. So when we're looking at the GLP, GIP, that's tirzepatide. This is going to, shrink that appetite. It's going to help treat the insulin resistance. It's going to help calm the metabolic chaos. It's going to help protect your lean muscle. But if you stop too early and you haven't developed the new habits, that signaling is not going to be retrained, and weight can tend to kind of rebound slowly back. And so you have to just, if you decide to go off of it, you don't go cold turkey, you kind of titrate down and maybe do microdosing for several months. And then maybe you spread it out where you're doing 2 shots a month, and then maybe even just 1 shot a month. And how is your body doing? Are you metabolically sound? Did you fall back to your old habits? Because let's be real, we can't be kind of, I hate to use the word stupid, but we can't be stupid about this. We have to be smart. Use this to make sure your habits are in check. And for a lot of us, our habits are in check, but we just need something more. And we don't know what that is. But I'll tell you what it is. It is the signaling. It is your body now having what it needs to do what you're providing for it to do. But before it didn't have, say, the raw material to do that. So for people who want more that diet, kind of, I want to achieve a certain weight. Maybe you have 40 pounds or 50, 60 pounds to lose. You definitely want to plan for 9 to 12 months. Using the GLP GIPs as a tool compresses that timeline, stabilizes the signal so your habits can stick and your results can, keep going, for weeks and months out. The dosing kind of, I like to think of this as our dosing philosophy. And this is where you can't do it unless you're using compounded versions. So we can customize for your goals, your hunger drive, your stress, your gut, your hormones. Are you in a menopausal or stressful phase of life? Here's the thing, you can start low with these and you can titrate slowly up, or you can start at a weight loss dose and see how that goes and titrating up and then maybe titrating down. But the big thing is we have to reduce inflammation, and inflammation is one of the biggest drivers for weight gain. And so as these are in the body, they're really anti-inflammatory, I'll say medications, but these peptides really help with the puffiness that we feel. And when we're puffy, we have water that's making our joints feel tight, our hips, our knees, our face looks puffy, and we look unhealthy. Our skin isn't vibrating well. I don't wear makeup anymore unless I, have an event. My skin is better. My muscle structure is better. I actually gained muscle with minimal exercising while I was on Tirzepatide. So the whole muscle loss and blindness and hair and all of that, that is a dosing issue first and foremost. So if you've got some autoimmune issues and stuff like that, I would highly recommend working with somebody who works with at least Tirzepatide and is using compounding pharmacies, because the other ones have just some other things that could just trigger autoimmune responses. So you want to be careful there. Let's see. Uh, a lot of people who have, metabolic, I'll call it metabolic triage for a lack of better words. It's just the body's in chaos right now. And so when you start, no matter if it's low dosing or weight loss dosing, these are signaling peptides or hormone signaling peptides, just like insulin. Insulin is a peptide. So if you have a problem with peptides, then you should have a problem with insulin, because it's kind of based off of very similar biological, physiological kind of treatment of in the body. So for a lot of people who have like just a lot going on, I will often just start them on a low dose of Tirzepatide, because in these first few weeks, what's happening is it's helping fix some of the liver issues. It's helping to get the body thinking more about fat burning, helping with the gut. It's helping with leptin and insulin signaling. And your body, if you're totally inflamed, your body really doesn't care that you want to lose weight. It's going to be working as much as it has available to help with the inflammatory response. Because remember, stress and inflammation are basically put together are the number one killer and the number one root cause of just about every single disease known to man. All right, so beyond GLPs, I just want to mention a couple of my other favorites. I have lots of them that I am studying and trying personally. Um, we love peptides. I've been using them since 2020. And so one of the ones that I just started using again because I had a little bit of a shoulder injury, and just in 4 days I'm already like, I'm sure it's not completely gone, but it feels pretty good. BPC-157 combined with TB500. This is known as the Wolverine Stack for a reason, because what do Wolverines? They heal so fast, right? It's like instant. So think of tissue healing, tendons, ligaments, fascia, gut lining. This is one of the best things for people who, maybe work out really hard, or they are going in for surgery. They could start this before surgery and then come out of surgery already starting to heal. These are not FDA approved. There's a reason they work. That's why. And the millions, or should I say billions of dollars that it takes for these studies. If that's a big thing to you, I guess keep doing what you're doing. But um, millions of people are using the Wolverine Stack for healing, and it's been around since I think the 70s. So it's just crazy not to look at these if you're struggling with some like really inflammatory issues, or you have some issues with healing or tissue repair. And also, it helps with visceral fat as well. Because what did we talk about? When you have inflammation, the body doesn't necessarily want to release fat. So, very important. NAD plus, this is a big one. Like I've used, I have a great strip that has, it's an NAD kind of boosting that's really been beneficial. But I do love NAG injections because it is a straight, excuse me, it is a straight shot into the system. This supports your mitochondrial, your ATP, which is your energy production, and uh, energy output, right, for our cells. The sirtuins, which are our zombie cells, it helps get rid of those. These are cells that aren't dead, but they're not alive, but they're infectious, and they will infect healthy cells. And then, of course, one of the big things it's known for is DNA repair and brain health. So, and the other thing with GLPs, which I didn't mention, is they have the ability to be very neuroprotective, heart protective as well. And it was first discovered to help with addiction and mood enhancement. So GLPs with an NAD is like, poof, you're going to feel great. So why do we want to do shots versus say supplements? Well, first, shots bypass the gut that can create it'll create a faster responsive pulse for the release of that. Oral NR or NMN, definitely don't do NR. Look on your supplement. If it says it's an NR supplement, avoid it. It's not worth pennies. NMN can be better, but you have to know this will raise your blood NAD, which is good, but the responses are very variable. Tissue targeting is inconsistent. Human data for injections um, is so much better to show what it can do. But supplements just get destroyed in the gut. And you have to take some other things with the supplements to actually, whatever would get through to the bloodstream, to help it get to the cells. So it's definitely not just take a couple pills and it's going to do all this stuff. If it is doing that to you, I don't know, it could be just, you know, what do they call that? Just a placebo effect. So when you're using things like sub-Q, this is going to be just a direct hit into your bloodstream. You don't have to worry about the gut or anything like that. IVs are the gold standard, but be prepared if you want to do IVs. These can cost thousands of dollars a month, and they can take up to 4 hours just to deliver a dose of your IV. So it's not feasible for the majority of people. So injections are the next best thing. The other one I like is a growth hormone, releasing hormone. Um, the two that I like the best that I have used for several years now is Tesamorelin and Ipamorelin. And now I love that you can get them together. It's great. Really, the goal of these is to restore your youthful pulsatile growth hormone. So you're not injecting growth hormone into your body, but what you're going to do is you're going to help your body with its own production of growth hormone, and you're not going to get these crazy spikes and unnatural pulses that aren't healthy. So what this will do with the tesamorelin, it's like turning the key to your car and getting that spark and initiating that growth hormone. And then the ipamorelin is kind of that press on the gas just to like pulse it about 4 times a day. It's going to be strongest at night. So most of these injections are recommended to take, an hour or so before bedtime. And if you're going to bed at midnight, that is not good for your own growth hormone. You do want to try to be asleep, I would say by 10:30, that's going to be your best. But this is something that is going to help with sleep quality, body composition, specifically visceral fat. It's going to help with skin, collagen tone, recovery. Just think of like when you were a teenager, how much energy you had. It helps with that deeper sleep. I mean, there's so many benefits to this. If you have any kind of active cancer, there's never been a peptide that has caused cancer. However, these do help with cellular creation. So if you're in an active cancer state, this would not be the best choice for you. But we've had patients come to us where doctors had referred them to find someone who works with microdosing or low dosing, the GLPs, because we know sugar feeds cancer. And if you're stressed and you're in a depressed mode and you're scared, what are you going to do? You tend to eat not the healthiest food. So these can really help with the glucose management and insulin management when you're in that cancer state. So these are actually being referred to by oncologists to help with cancer. That's the GLPs. But for the growth hormone, that's something that, you probably just want to put that off a little bit and, not go there right now. Okay, so here's some safety guardrails that I personally won't compromise on. We use the legit pharmacy 503A clean labeling. They don't add salts to this or any kind of crazy fillers, sterilizing or testing, patient screening. We talk about meds and what's going on in your body with some of your organs and glands and systems. Do you have reflux? What's your bowel habits? Hydration? What's your protein and exercise? Like these are conversations. If your doctor is not having these with you, that's a problem. Also, titration and coaching. We have to make sure you understand protein targets for your body, the importance of fiber, electrolytes, movement and walking, at minimal resistant basic exercise, activating that muscle. When you activate the muscle, the brain says, hey, muscle needs to be like, you can't go after it. But if you're not activating the muscle, we can live very healthy. I don't necessarily say that's healthy, but we can live a long life without muscles. We see it all the time. Just look at some of our grandmothers or some 60, 70, 80-year-olds who don't really exercise and they're just nothing but flab. They have no muscle structure. And I don't love to exercise. It's not my favorite thing to do, but I force myself to do it because I know that muscle truly is the key to longevity. And the more muscle you have, also the more calories you're going to burn at rest. So, in weaning off of these meds or reducing them to once or twice a month, this we look at your metabolic markers, your appetite cues. Are your habits stabilized? Do you have self-control? And then we can taper you down to the lowest effective dose. All right, so just a couple more things and we'll finish up here. I do want to take just a moment to talk about Ozempic and the ingredients. So this is just Ozempic. So this is pretty much, I bet, across the board. I haven't looked at Tirzepatide, but I'm sure it's in it because it has to for stabilization. And so on the label for Ozempic, it states that it has disodium phosphate, propylene glycol, phenol, water, and pH adjusters. And this is normal for stability of the peptides and to be sterile because of the type of injection, the pen that they use. They have to put these in there. Some patients, they come to us because they've seen this and they don't want this stuff injected into their body, and you shouldn't either. So be very cautious of this when you are looking at, okay, is my insurance going to pay for this? It's not going to be $149 for most people. This is Medicare people, whatever is being put out there right now. There's a lot of reading between the lines. I've been reading the articles, and you just be very careful because it's not what it seems. So that first and foremost. Okay, so bottom line for patients, we use peptides to heal signaling, not to sugarcoat symptoms. That's not, peptides heal, they don't sugarcoat. Drugs, they sugarcoat. They hide what's really going on because you can take a pill for something, but the problem's still existing. They haven't solved anything. I like Tirzepatide. It generally will always outperform semaglutide unless maybe you just want to work on brain health or like Parkinson's or Alzheimer's. Low dosing or microdosing semaglutide truly can be enough for you. But for when it comes to weight and glycemic control, you do want to kind of look big picture, and Tirzepatide does give us more bang for our buck. Compounded doesn't mean sketchy, it means custom. When done legit through 503A pharmacies with the right molecular structures, the right, being sterile, and the right dosing for you, this is where we get big results. And I would be concerned about the big pharma brands because that's not what they're into. We know they're into making money, right? And so who knows what's going on behind closed doors there. I don't get into that because I don't work with it anyway, but I would say you need to ask these questions. And would you need to take this forever? You want to make sure you understand your plan, your results, and what that looks like. We kind of taper, after the biologically, the habits and all of that are locked in. Otherwise, the body just isn't going to be able to, do what it's supposed to do without it. So there is a time frame you want to plan for this. And, can you lose weight on microdosing or low dosing? And often it's yes, especially, I mean, you'll lose, and when I say weight could be water. You have muscle and fat that are marbled together. So whenever you go on any kind of a diet, even if it's just a restriction diet, you're going to lose some muscle, but you can actually regain it back after kind of the initial couple weeks. You can start you know, working on the muscle. You have to be lifting weights. You can't just think I want to gain muscle and then you don't lift or do anything to gain muscle. So you have to make sure you're eating enough protein and you're doing what you need to do. But the body needs to first go after the inflammatory issues and making sure some of those other things that might be going on in the body are getting self-corrected. Side effects, most commonly, you're going to see maybe a little bit of nausea a couple days after the first shot, or kind of a low grade headache, just a dull kind of headache, really. You might feel overfull, and you don't want to overeat. You need to be very conscious of what you're putting on your plate because we get habitual, right? And we're used to putting a certain amount of food on our plate. So you want to start small. Why don't we want to use pills? Again, most peptides don't survive your stomach acid. The injections are they're so much more reliable. I personally think they're a waste of money. If they're liquids, or they've got drinks out now. But yeah, for the amount of money and depending on your results, if you got all the money in the world and you just want to try a pill, go for it. But you're not going to get the results. BPC-157 TB-500, these are what can help with pain or injury. I cannot believe how well they work. But these are very specific amino acid formations of peptides that are designed to take the messages throughout the body to fix and repair 24/7 when it's present. And then NAD shots versus the, NMN or NR pills. Pills are going to raise NAD in the blood, most likely, but if they have to go through the gut, it's basically maybe you're going to get 20% out of what you're taking. So you'll have to take more of it, and then you should take some other supplements that can be very expensive to make sure that it's working. So injections is the most economical and, bang for buck, definitely worth doing the injections rather than IVs or pills. So that's kind of just a quick overview. I hope this helps. I know it's a little long, but as you can see, there's a lot to talk about. And if you have any questions, please just reach out and comment. We'll check back on this. But if you need anything, I'm happy. You can find me on Messenger and or peptide_minute on Instagram and send me a message. All right. I hope this helped.